cardiac diagnosis codes, oh, these are, you know, I love diagnosis codes, as many of you already know, but cardiac diagnosis codes can be a lot of fun, and there's some that you should probably just make note of. Especially if you're working with maybe Medicare patients or patients more likely to have cardiac issues. The ones that I pulled out this time were 414.00, 414.01, 443.9, and 429.2, and 412. Now, these are ones that you could see quite a bit, and we even created a little poll after I talk about them to see if you catch the nuances of these codes. Common cardiac codes that you should just be familiar with. The first one, 414.00, coronary atherosclerosis. This is CAD, okay? If you're not familiar with that abbreviation, that's, you know, when someone says they have CAD, that's what it is. But what makes this CAD different is this is the one you use after a person's already had a CABG, okay? And that means they've had a bypass graft put in, okay? And so think, if somebody's had a CABG, if it's in the, you know, medical history or in the chart, then you're going to use 414.00. But if a person has CAD and they've not had a CABG done before, it's going to be 0.01, okay? So if they've had a CABG, use 0.00, think the 2 zeros look like 2 heads of cabbage, 2 round circles there. If they've not had a CABG, oh, look, it doesn't look like 2 zeros, it's 101, so no CABG was done. But that's, again, cardio atherosclerosis, and it's CAD. Okay, now, then let's scroll down just a little bit. Another common code is 443.9, peripheral vascular disease, unspecified, you know, so they're just saying the person has PVD, and a lot of times it'll be written PVD, especially in handwritten notes, but they'll say, you know, patient has PVD. Also, intermittent claudication, or claudication, you'll see that a lot of times in the reports. I've never really seen documented spasms of the artery, but that obviously falls into this because it's listed. But 443.9, if a person has PVD, they have it for life. So, you know, as far as like with HCC coding, if I have a patient that has 443.9 and they're on a medication for that, or he checks the peripheral pulses, you know, or the, you know how you see them pinch their fingers and their nail bed to see if how fast it, how long it takes for the color to come back, stuff like that. Anything that he does to check the peripheral vascular system, it concurs or gives you additional documentation the person has 443.9, peripheral vascular disease. It's something you see pretty often, and again, if they've had it in the past, that means they've still got it. Okay. Now, keep in mind, though, in red here, when you look at that code, that excludes atherosclerosis of the arteries of the extremities. That's a little bit different. So 429.2, this often is confused with PVD, but it is actually a different. It's cardiovascular disease unspecified, or, and you'll see these acronyms a lot, ASCVD, atherosclerotic cardiovascular disease. Okay, that is different than peripheral vascular disease, because peripheral is exactly what it sounds like. It's those peripheral or outlying vascular system that is diseased. With cardiovascular disease or arteriosclerotic cardiovascular disease, that then think of it as like starting at the heart or and working its way out. Okay, it's a little bit different. Let's see. Oh, and now make a note here. See this use additional code? Remember when before we saw the code first. That's a guideline you want to pay attention to. Use additional code. That means there's going to probably be another code after 429.2. Okay, so if there is the presence of arteriosclerosis, then you're going to code that in addition and put it behind 429.2. Okay. Now, one that gets people sometimes is 412. This is a code that carries an HCC. It's, really does establish the level of disease in a patient, but it's an old myocardial infarction. Now, you can, I think it's kind of funny when it says healed myocardial infarction, because you can't heal an MI. It's actually, when the heart tissue dies, it dies. But, if you can see a past MI on an EKG, and I know a lot of people may not have known that, but even like my mother-in-law went in and had an EKG here not too long ago, and they said, oh, by the way, when did you have a heart attack? And she said, well, I've never had a heart attack. Well, we're showing an old MI here on your EKG. So they can tell that there's been death of heart tissue at some point, whether mild or severe, by an EKG. And that's another reason why when a person comes in with chest pain in the ER, one of the first things they do is they slap that EKG monitor on you, because they want to know if you're having a heart attack or if you've had a heart attack in the past. But the key about 412, it cannot be used unless it's an old MI. And an old MI is classified after 8 weeks, and you have to have dates to document that. You cannot use 412 unless you can prove that it's after 8 weeks, okay? And let's see. Oh, another thing, report diagnostic evidence of an old MI, which is not causing trauma or something at the present. So if a person comes in and they've got a cough and they're being seen for that, but they're not having any problems with their heart, but they had a heart attack last year, then you're going to report 412. It's kind of like a diabetes thing. Once you've had it, it's going to follow you, okay? So if you scroll down a little bit, we've got a neat little poll, okay? So here's the information that Lauren was nice enough to put on there. So it says, the date of service is 8/15/13. Patient is seen by a cardiologist today and follow-up. And hold on just a second if I can make this go down here. Let's see. Mr. Smith was discharged from Feel Good Hospital on 8/1/13 after a stress test resulted in an MI. Patient is doing much better considering the rough time he had in 2001 after his CABG. His CAD has not improved, and he has a new diagnosis of PVD. Which code cannot be used in this case? So now we can launch the poll. Which one of those 3 codes do you think they cannot use in that case?
And just to help out, 443.9 is the PVD, the peripheral vascular disease. B, the 414.01 is the CAD of the native coronary artery, and 412 is the old MI. So PVD, CAD of native, and old MI. 37% voted, 40%.
Just take a guess if you don't know. Yeah, you can put it in the chat too for those iPod users. A pad, not iPod.
Also, everybody, we've got a lot of questions tonight, and some of you are asking, how come we didn't answer questions? We've got so many questions here, so our apologies. We'll try to get to them at the end, but you can always ask them at the forum, which we'll go over at the end too.
Yeah, and the way the webinar works is we answer questions that were previously submitted. We try and answer as many on the fly as we can, but this is we need time to research questions. So go to codingcertification.org/forum if you have a question that you want us to answer. That's the best place to put it. We pick questions out of there for this webinar, and also there's many coders that monitor that forum and will answer questions. You get nice lively discussions. Okay, so I got 62% voted. I'm going to close the poll in 5, 4, 3, 2, 1.
The correct answer is C, 412. It hasn't been more than 8 weeks. So you cannot use the cancer or the 412 if the patient hasn't. You have to have not had a heart attack more than 8 weeks.
Tricky, tricky.
Yeah. Because I thought some of you might do the PVD, or no, the PVD, once you got it, he got a new diagnosis, you got it. But the CABG, you're right, some of you were thinking the CABG, but it says he had a CABG last year, and he didn't have a good time with it, in other words, you know. So you got to, that's documentation you can use to get the correct code. I love doing things like that.
Hey, Alicia, can you take a minute to explain briefly HCC coding? You've mentioned it a couple times, and a lot of people are like, what is that? They're freaking out. Oh, my God, it's another coding thing I need to know.
Well, and actually, HCC coding is really gaining grounds, and it's a way for payers to project how much money they need to set aside for a patient for the future. So these codes like 412 carry an HCC. And it's an additional code that's, I guess you could say it carries weight. So if a person is a diabetic, you know, he's a type 2 diabetic, and he would have an HCC of 19. And then if he's had a heart attack, a 412, then you get to add like a, gosh, I'm trying to remember what 412 is. I think it's an 88. But there's regular HCCs and there's RX HCCs. But with those numbers, they can project how much money they need to set aside for the patient next year. So if you have a person that is on, and it's only done with Medicare patients right now, but it's going to be across the board as we're moving away from CPT to do reimbursement and getting into diagnosis to reimbursement. But you're going to see if a person has diabetes and he had a heart attack a year ago and he has PVD. Okay, that's 3 really heavily weighted HCCs that tell that payer, okay, we need to set aside X amount of money for that patient for next year's care so that we don't run out and we have enough money to take care of them. Now, if you have a person that has diabetes, then you have, and he has neuropathy, and he has already had an amputation. Then because of those HCCs, how much money they need to set aside for that person. And then you have another that has COPD, but that's it, nothing else wrong. They know exactly set aside for that patient. And then you have a patient that 2 years has certain things wrong with them, but nothing carries an HCC. They had, you know, pneumonia or something that's not a chronic condition. That's what that HCC stands for, the hierarchical of chronic conditions. And a lot of fun to do. I've been doing it for a while now, and it's fascinating. And especially if like ICD-9 coding, that's all you deal with is ICD-9 coding. So it's kind of something that you're going to see more and more of, and hopefully we can get some more things on or talk about it more in the future. I'll talk about it another time.
So I just pulled up 2 HCC. I knew we did this before. What is HCC coding? So I put it in the chat. There we go. Yeah. So a little shortcut that I keep showing, but it bears repeating. If you go to Google and you type in your keyword first, and then you do site : and you can do aapc.com, codingcertification.org, it will find anything on that site with that information. So if you know we've discussed it before and you want to see if we have a video clip of it or if we're discussing it on the forum, this is a great way to do it. That's how I find a lot of stuff. I know we did that. Let me go check. So just site : and then codingcertification.org. You need the colon touching the URL. Okay, so we've actually talked about this quite a bit. So there you go. that works for anything, not just our site.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.